goodness.
You got halfway through the changing cycle before we had to come back.
I change my pants later. Okay. All right. So fear of the dentist keeps millions of people from getting regular checkups, which can lead to major oral hygiene problems later on in life. Now, here to help alleviate those fears are Dr. Kevin Barrett, Dr. Toni Henderson, and Dr. Ziv Simon. Please welcome.
So, guys, let's just jump right into this because there is an overwhelming fear to come to the dentist office for many, many people. But let's look at that for a little deeper. What is the underlying reason for that fear?
Really, the fear is coming from the unknown. We don't know what we're facing. Some of us are afraid of pain. Some of us are afraid of noises. And as long as we are aware of what's going to happen, we can prepare ourselves and be ready for our treatment. So it's mostly unknown.
So how do we prepare ourselves, especially little children? I mean, because I'm not afraid to go to the dentist, and I don't know if it's a myth because you think you're going to have pain, but nowadays it's not like it was in the old days.
No more pain.
Well, you hit it right in the head with that too, because in the 40s and 50s it was sort of a nightmare sometimes, but the modern dentist really takes care of that concern and watches so that patients nowadays really don't feel anything for the most part, and I mean nothing.
Right, and with children, I tell parents to bring them in as early as possible, maybe around age 2. You may don't make an appointment for them, but just bring them along for your visit, and we let them hop in a chair, raise the chair up, have fun with that, spray a little water in their mouths, use the suction, we call it Mr. Thirsty, and maybe we'll take a little look inside. If they don't want us to, we stop there. 6 months later, they come back. Maybe this time we can add a little fluoride and brush their teeth, and each time they come in, they're a little older, they get to know me, they know nothing bad is going to happen here.
Well, speaking of kids, my kids wake up in the morning and they have dinosaur breath. They'll be like, guys, brush your teeth. But, you know, and it's, you know, they're kids. But for people who really deal with bad breath on a serious level, you know, that it's a chronic situation, what are some of the treatments for something like that, the cause and treatment?
Well, really the cause is, first of all, not brushing and flossing your teeth properly. But what many people don't know, that the source of bad breath mostly comes from the tongue.
The tongue.
The tongue itself. Meaning if you have a postnasal drip and all this yucky stuff lands on your tongue, it stays there, it festers, it starts to smell bad. So actually the simple solution is brushing your tongue, cleaning your tongue.
I have one of those instruments that cleans your tongue. I do it every in the morning and in the evening, and just scrape it. Scrape it.
That helps a lot.
Right, and you should brush and floss before you go to bed, and that helps with morning breath. Just get all that bacteria out, and you don't have to worry about waking up.
So I guess cutting the tongue out was a bad idea. For I didn't do that. So we have some viewers who've written in, or they've sent videos in with questions for you guys, which helped pull this segment together for us. So this is Sarah from Wisconsin. Take a look at her question.
Hi, my name is Sarah, and I would like to know what you recommend to use for teeth whitening.
That is a big question right there, because so many people want the white teeth.
Well, mostly people are whitening their teeth these days with gel. But the thing about whitening is the speed. Do you want to have it done in the office with lasers or lights? Do you want to have it done for 1 hour, 2 hours, or wear trays overnight? Dentists will make you trays. But like anything else, speed is important. So now they've come out with a new 15-minute-a-day bleaching gel, which is also less sensitive. I tend to use this. It's called Rev. It's a very good product, and it's new.
Does it erode the enamel off your teeth when you use the
bleaching? Just sounds like no.
I've bleached my teeth over 300 nights in 15 years, and it really won't hurt your teeth.
You have very white teeth.
Well, thank you very much.
Yeah.
You do too.
Well, you guys do have to take care of your teeth.
I've been whitening my teeth for probably about 20 years.
But don't you, when you put that in your mouth and you leave it on overnight, aren't you swallowing the chemicals? To bleach your teeth have to be pretty strong. Aren't you putting it into your body?
Well, you don't want to put that much gel in the trays where you're swallowing it. Just the right amount. You place the trays in. Any excess, you wipe it off. And you don't have to wear them at night. You can wear them during the day.
For 15 minutes at a time?
Or longer, or longer.
Sure. All right, so let's talk a little bit about the long-term, the benefits of going for regular checkups. We know what those are, but there's also the costs that are associated with it. Is the checks and balance system with this going, wow, it's so costly to do this? Let's look at that, balance.
There's really an investment in your health and coming to the dentist and checking for all those problems. But in reality, once we address any type of gum disease, decay, cavities, we can actually prevent lots of problems in the future, thus preventing expenses. So actually it's cheaper to get all this treatment done initially, in a comprehensive way, rather than going to the dentist to fix things.
Sort of pay now versus pay later, in a way, or much more later.
Why is dental insurance so expensive?
It's really not an insurance. It's more of a benefit. It maxes out after a certain amount. There are certain restrictions. So we find that dental insurance helps with cerertain treatments that are very minor. Once you need major procedures,
they don't
you basically max out.
Yeah, you do.
But they haven't for 50 years.
It's not an insurance, it's a benefit.
It's a benefit.
But preventative work is usually covered at 100%. And that's when the insurance companies prefer you come in. Come in, let's prevent the problems in the future so that you won't need the more expensive treatment down the line.
How often should you come in for teeth cleaning? Because my dentist drags me in every 4 months for teeth cleaning.
On average, every 6 months.
That's about what I do.
Some a little more often.
So, another viewer question. This is from Kristen.
Hi doctors, it's Kristen, and I'm getting these pesky canker sores that everybody gets, and I just do not know how to get rid of them. Do you have any suggestions for me?
All right.
Well, canker sores or after ulcers are very frustrating. They're very painful. Come in multiples or bigs and small ones.
What causes them?
It's actually unknown at the moment, but we feel it could be an allergic reaction. It comes about with stress. In stressful situations, it can actually come about. Really, the treatment is palliative. We place certain gels that numb the area for a couple of days and basically avoid things that make them hurt. Like salty things, spicy things.
It's also important to get it looked at because canker sores can be confused with herpetic lesions. In today's world, you should go into a dentist and see exactly what it is because there's a lot of confusion between certain other problems.
Sure. We'd love to go on, but it's time for me to floss. So I'm going to step out. Thank you so much, guys, for being here and addressing some of the questions and concerns. Yeah, I know.
Do it.
All right, we are heading over there in the backyard. We got some flying dog agility tests to put our home and family pooches through with Perry Simon. Where is Freddie? There he is.
Big old Freddie.